Hello, everyone. Thank you for joining us. I'm Steve.
And I'm Scott.
And together we are Backyard Musings. We're broadcast from Apple Valley, California. Science and technology.
Yep.
That's what we like.
Yep.
I think it's fascinating. A new study published published February 17th in JAMA Internal Medicine by researchers at the University of California, San Diego, Qualcomm Institute and School of Medicine.
Whew. Finally, somebody from California.
Yeah.
Or
with
the
researching.
US. Yeah.
And this is a unique U.S. thing. Yeah. Highlights a sharp rise in sports betting and gambling addiction, help seeking. This increase has followed the 2018 Murphy v. NCAA Supreme Court decision, which allowed states to legalize sports betting, with billions wagered and online sportsbooks making betting effortless. Help seeking for gambling addiction has hit record highs, yet public health efforts remain dangerously inadequate. Without urgent reform, stricter advertising, stronger betting safeguards, and expanded treatment services, the crisis will only worsen. Would you like to know more?
So this is a quote. When the Supreme Court legalized sportsbooks, a venue where people can wager on various sport competitions, in Murphy versus NCAA, public health experts paid little attention. Said the study's senior author, John W. Ayers, PhD, who was vice chief of innovation in the Division of Infectious Diseases and Global Public Health, deputy director of informatics at UC San Diego Altman Clinical and Transitional Research Institute, and Qualcomm Institute scientist.
Man, that's pedigreed there.
That's a big business card. Another quote, now sportsbooks have expanded from a single state to 38 states with hundreds of billions of wagers, mostly online, coinciding with record-breaking demand for help with gambling addiction as millions seek help. So we talk about it in the state of the United States, but this is huge in Europe. I mean,
what do they bet on? Dog race?
Soccer, you name it. They bet on everything. Yeah, it's big soccer, horse racing, all kinds of stuff. I mean, it's huge.
Rooster fighting?
Probably. I don't know.
All right. Since the 2018 Supreme Court ruling, the study documents staggering growth in the sportsbook industry. The number of states with operational sportsbooks grew from 1 in 2017 to 38 in 2024. That's 2/3, right? Total sports wagers skyrocketed from 4.9 billion in 2017 in that one state to 121.1 billion in 2023, with 94% of wagers
during 6-year window there.
Yeah, during 2023 placed online. Sports betting has become deeply embedded in our culture, said Matthew Allen, a third-year medical student. From relentless in advertising to social media feeds and in-game commentary, sportsbooks are now everywhere. What was once a taboo activity, confined to the fringes of society, totally fringe, has been completely normalized. The researchers note that these trends are projected to grow in no small part due to the industry's investment in sportsbooks as the future of gambling, as evidenced by Caesars Entertainment's rebranding to Caesars Sportsbook and Casino.
Yeah, no, they're it's a big thing. When you go into a casino, that area used to be, a few TVs or a few widescreens that you could watch. Now they're just huge, like arenas. It's incredible. So
my brother does this, and he's already in bad health. Yeah.
Oh wow, really?
Yeah.
Well, there you go. He's pretty close to home.
66, and he looks like he's 86.
Oh wow, kind of like me. Despite gambling addiction as a recognized disorder in the Diagnostic and Statistical Manual of Mental Disorders, it remains largely overlooked in healthcare and public health with no formal ongoing surveillance. That's from Kevin Yang, MD, a third-year resident physician in the Department of Psychiatry. To go on with a quote, without systematic surveillance, we are flying blind while millions bet on sports. To fill this gap, the research team analyzed aggregate Google search trends for queries that mentioned gambling, addiction, addict, anonymous, or hotline from January 1, 2016 through June 30th, 2024. So
I wonder what's
that money, though. That is astounding. $5 billion to $122 billion.
I'd like to get a small little slice, man. What's the barrier to entry to being a sports book? You just got to have money so that you can pay out if you lose.
Well, you gotta have a source for that. But
I mean, what's to stop me from doing it? I'd like,
got to get a gambling license.
I could.
So, do you know anybody that's Indian? I mean, they have in our state they have rights to gamble.
No, I know that there's tribes around, but I don't know anybody.
Yeah, some of those places are.
I need to be Indian.
Big and popular.
I need to be Indian.
Well, I don't know, but you need to
be a sports book.
Online. I don't know. I think I don't know
if
it's
website,
really legal in California yet, other than being if you're an indigenous people. So
if I could just get 1 million per year from doing sports book, I'd be happy.
You'd retire even more?
I would retire even more. I'd be more retired. I've had my toes up. Toes up.
Okay.
All right. Quote, many people struggling with addiction don't openly discuss it, but they do turn to the internet for answers, end quote, said Davy Smith, not Davy Jones. He's an MD, professor of medicine, and director of ACTRI. By analyzing search trends, we can gain real-time insight into the true scale of gambling addiction in the U.S. Parallel with the growth in sports books, internet searches for help with gambling addiction, such as, quote, am I addicted to gambling, end quote, have cumulatively, like the internet's going to tell you.
If you got to ask, I'll just tell you that's not probably a good thing.
That's like saying, I'm the president, and nobody respects you as the president. You know, if you got to tell people that you are.
Yeah.
Have cumulatively increased 23% nationally since Murphy v. NCAA through June 2014. This corresponds with approximately 6.5 to 7.3 million searches for gambling addiction help seeking nationally, with 180,000 monthly searches at its peak.
Monthly. Wow. By state, the opening of sportsbooks consistently correspond with increased demand for gambling addiction help seeking. Let me repeat that. With increased demand for gambling addiction help seeking. Okay, here we go. We're going to sort some stats here from the different states. So Illinois, 35%. Massachusetts, 47%. Michigan, 37%. New Jersey, 34%. New York, 37%. Ohio, 67%. Wow. Pennsylvania, 50%. And Virginia, 30%. All experienced significant increases in gambling addiction-related searches following the opening of any sports book in their state. See, I had no idea that it was this. I didn't. If somebody had asked me 38 states, I would have said no way. But I guess so.
That's great. I wonder it'll probably go up.
Yeah.
I wonder if Hawaii is a
because you know each state. It's like when California started the lotto. You know, it was supposed to go to schools and education.
Oh yeah, I remember that.
That was a joke, but.
Yeah, that was like the bait and switch.
Yeah, and the state was raking in dough.
Oh, yeah.
Big money.
Okay. Quote, the significantly higher search volumes observed in all 8 states make it virtually impossible that our findings occurred by chance, said Atharva Viola, a student from researcher in the UC San Diego Qualcomm Institute. That's the elders. Quote, statistically speaking, the probability of these results happening randomly is less than 1 in 25.6 billion.
Wow. The study found that online sportsbooks had a substantially greater impact on gambling addiction help seeking than a traditional brick and mortar sportsbook. For example, in Pennsylvania, the introduction of retail sportsbooks led to a 33% increase in gambling addiction help seeking searches during the 5 months before online sportsbooks launched.
That makes sense. I mean, you just go to your device and boom. You don't have to drive to the casino. Right?
Well, I guess. I mean,
or call up your bookie, I guess.
Making it easier. That's just, that's just not.
You could be on the toilet and just boom, 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 on
anywhere.
And pull the lever for the slot. There you go.
Yeah. When online sportsbooks became available, searches surged 61%, a significantly greater and more sustained increase that persisted for years. This pattern, this quote, this pattern highlights our amplified risks associated with the accessibility and convenience of online sports betting, added Adam Poliak, PhD, Assistant Professor of Computer Science at Bryn Mawr College.
Bryn Mawr College. Well, Bryn Mawr Road is down the hill, Loma Linda.
It might. This college might be locally here in Southern California. I don't know.
Quote, the expansion of legalized sports betting to always be at arm's reach has outpaced our ability to understand and address its public health consequences, said Nimit Desai, a third-year medical student. Quote, our findings are a wake-up call for policymakers, healthcare professionals, and public health advocates to act now to mitigate the risk posed by expansion of sports betting. The researchers recommend the following interventions be explored. Increase funding for gambling addiction services using sportsbook tax revenues to ensure accessible evidence-based treatment program. Let's tax it, right? If it moves, tax it. Enhanced advertising regulations, similar. Well, let's regulate it too.
Yeah.
Similar to those implemented for tobacco and alcohol to restrict where products can be advertised and who can be targeted. Clinical training programs for healthcare professionals to improve gambling addiction diagnosis and treatment. I'm all for that. Stronger safeguards for online sports betting, including betting limits, age limits, enforced breaks, and restrictions on credit card use for gambling. Yeah, but
expanded public awareness campaigns highlighting the risks and warning signs of gambling, reducing stigma, and encouraging early intervention. Ongoing data sharing and research collaborations, uniting regulatory bodies, healthcare providers, and regulators to assess the effectiveness of interventions and refine policies in real time. Quote, sportsbook regulations are lacking because the Supreme Court, not legislatures, legalized them, concluded Ayers. Congress must act now by passing common sense safeguards. History has shown that unchecked industries, whether tobacco or opioids, inflict immense harm before regulations catch up.
I don't know about that.
Yeah,
I mean, that's a bold statement.
It is. I mean, let's just face it. Just there should be ways that you should be able to cut somebody off. If they get in too deep. I mean, if they're doing it legally, there should be ways to regulate that, right? You just cut them off. But I mean, if they're going through shadows, like dealing with, like you say, a bookie, it's maybe not. It's got Bubba next to him that, he'll come visit you if you don't pay up. So that would be good.
Break your legs.
Yeah. We can either take proactive steps to prevent gambling related harms or repeat past mistakes and pay the price later. Cool.
Wow. Interesting segment.
Yeah.
I mean, I didn't know it was that prevalent.
Yeah. I mean, I personally have never known anybody that's, I think, gotten addicted to gambling. I know a lot of people that do. But
we were in Alaska hunting, and my brother's, we were out in the bush, and he's, monkeying around gambling.
Yeah,
that's very funny.
And you can gamble on anything. Vegas is just crazy with that. I mean, you can gamble on how many times somebody spikes the ball, or how many times somebody throws the ball,
or who's going to win the election.
Yeah, or whatever. It's out of control. So anyway.
All right, folks. Thanks for joining us. Hope you have a great day.
Do it responsibly. Take care, everyone. Thanks.
Where's that mouse?